In Sydney South, the Prime Minister is welcomed to an aged care centre after looking after carers with a 15% pay rise.
After the horrors exposed by the Aged Care Royal Commission, unions had asked for a 25% pay rise. But say for the 250,000 workers in the sector, this will make a massive difference.
A seismic shift in aged care.
Australia's 250,000 aged care workers to share an $11.3 billion pay rise over 4 years, a 15% wage top-up from July.
This is the pay rise that aged care workers need and deserve.
Providers paying above the award will be expected to pass on the increase and be named and shamed if they don't.
Publishing, as of 1 January next year, what providers are paying their workers, and they will have to attest to us in quarterly financial reports that they have passed that full freight on.
This RN 24/7 is such a big milestone because that means our older Australians will receive safe quality care.
From the pandemic front line to the picket line, nurses say they were left with no option but to strike today.
Exhausted nurses and midwives walking off the job.
It's just not sustainable.
From the southern border to the north coast.
We're not going to give up until we get ratios and to be able to provide safe patient care.
The evidence is clear. This is not a radical concept. Queensland, Victoria, South Australia, ACT all have ratios. New South Wales is falling behind. It's now our 4th strike and we've been pushed around, we've been bullied, we've been fined, but we've stayed strong and we keep standing together.
We are a so-called premier state, but honestly our healthcare system is absolutely appalling.
We don't have enough midwives to look after the amount of babies and mothers that we have that need higher care these days.
No area can be left behind in our fight for safe staffing ratios across our public health system.
By speaking up and taking part in collective actions like this, you've generated the pressure needed to force politicians to do better, and some of them are. So let this be a message to the current government: get on board or get the hell out.
Nurses and midwives are today protesting outside hospitals in New South Wales as they fight to scrap the shift allocation system that they say leads to burnout.
We're being told constantly by our state government that it's a world-class health system. It's not. They need to come down here on the floor and see what it's like.
From the streets to the steps of the Supreme Court, the union filing what it says is an unprecedented lawsuit against the state government.
It paints an alarming picture of our health system. Close to 500,000 nursing hours were missing, which equates to almost 60,000 shifts.
We're here because we need change so desperately and so urgently.
The fundamental issue here is that the system is broken.
The Nurses' Union has secured a major win, convincing Labor to overhaul staffing levels and set a minimum number per shift.
This is an important reform that goes to renewing public health in this state.
This is a really excellent first step and it meets the principles of our campaigning of shift by shift, enforceable, safe staffing minimums. From our perspective, this is the type of reform we believe is needed. It's absolutely not everything we want and we will keep campaigning.
Support the candidates who support ratios and vote like your life depends on it, because one day it might.
New Labor government brings fresh hope.
They feel like they've got people that are listening now, so we are ecstatic to see this removed. I suspect we will still have to fight for whatever percentage we get.
After months of protests, 58% of members in the New South Wales Nurses and Midwives Association voted to accept a 4% salary increase. It's the biggest boost for state nurses and midwives in over a decade.
Alongside this, the agreement will also see changes to current nurse-to-patient ratios in hospitals. But while the offer's been accepted, it was well short of what the union's been campaigning for.
Our pay claim was at 10%. It acknowledged that inflation was running at 7%. Even amongst those who voted yes, they are angry.
Cost of living pressure is a big thing, and again, that probably goes to the vote being accepted because nurses are under a lot of strain.
You are part of something big. Your action today will pave the way for future nurses at St Vincent's Private. Anything less than a fair pay rise and ratios is simply not good enough.
Ratios is a big one for us at the Mater, that we have safer working conditions and can give better care to our mothers and babies and all our other patients.
We are asking the board to meet with the nurse representatives and hear our stories and help us.
Today, nurses from two of our best-known private hospitals walked off the job, demanding a better deal.
Nurses and midwives from the Mater and St Vincent's walking off the job, concerned that without matched staffing ratios and pay parity, they'll lose experienced colleagues to New South Wales Health.
We want to know that when we come to work, we will have enough staff to keep our patients safe.
What's really important is that we maintain this unity, we maintain this solidarity. Nurses finally understand what they're worth. They're finally out fighting for it day in, day out, and they're finally winning. Ratios in the public system, better pay in the aged care system. The private sector needs to catch up, and that's the message you're sending today.